Hello, everybody. Just gonna wait like 2 more minutes. Hi, Brendan. Thanks for tuning in. Let me see. Hope everyone's having a good day today. It's Friday, so it's always a good thing. We love Friday. Hello. Thanks for joining. Excited to talk to everyone today. All right, we're gonna go ahead and get started. So happy Friday, everyone. I hope everyone has been having a good day so far. So today, like I had mentioned last week, we are going to be coming here every Friday for the month of September to talk about a different sexual health topic in honor of Sexual Health Awareness Month. And my name is Ibukun Amale. And I'm the AmeriCorps member for this year at Whitman-Walker. And today we're going to talk about just how to foster safe conversations about sex and just how to, make a kind of awkward conversation go as smooth as it can, and also the importance of having these conversations. And please feel free to leave any questions you have. You can just comment them and I'll try my best to answer them as we go on with the live. So just as an intro, and I use she, her pronouns, but just as an intro, during the past year, Whitman-Walker Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV/STI sexual health practices, access to care, social determinants of health, and general public health interventions. The next series of outreach sessions will focus on the current pandemic, COVID-19, and also ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you always. So the month of September is dedicated to raising awareness about sexual health. Sex is a normal aspect of human life, and it is important that we are all well informed about our sexual health. So according to the WHO, sexual health is defined as a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely an absence of disease, dysfunction, or infirmity. So sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences that are free of coercion, discrimination, and violence. So today, we just want to talk about having conversations about having safe sex and just ways to protect yourself. So first, I know it's true that bringing up these conversations can feel really awkward, but one thing you should aim for while approaching these conversations is having confidence. So if you're confident and bring up the conversation without judgment, it will encourage your partner or whoever you're engaging in these sexual activities with to be open to the discussion. So remember, nearly everyone who's having sex ends up having this conversation at some point. And many other people have had these same conversations before you've already done it. So you're not alone. So now let's talk about some important tips to help make sure that the conversation goes smoothly. So first things first, you want to pick the right time to talk. So, this is where you want to make sure that you're having these conversations and at a time where every party is comfortable, every party can feel like they're not being judged, and every party can freely express their thoughts and concerns without judgment. So you want to pick the right time to talk. Second, you also don't want to wait till the last minute. So it's not the best to have these conversations right before you start having sex. It's best to have these conversations sooner rather than later. And lastly, after you've had these conversations, I would recommend that you schedule regular check-ins or talk-anniversaries, as we can call them. And it's important to do this because it will create a culture that is fostering open dialogue and like continuing the conversation into the relationship and throughout the relationship. So now you may ask, what are some good conversation starters for these conversations about sex? So I have two that I'm going to share. And if anyone has any other ways they, have had these conversations before with success, you can leave them in the comment section. So one I have is, I'm really enjoying our time together. Can we talk about how we can move forward? And I really like that one because it's, letting the person know that, you're enjoying getting to know them, but also it's an open-ended question. So, can we talk about how we can move forward can really mean a lot of different things. And, that can make the conversation feel less scary. And another one you can use is, before we move forward, can we talk about our sexual history? When were you tested? What were you tested for? So this one is a little bit more direct, and it's asking specifically what were you tested for and, when were you tested? So it's going to hit all those points. What were you tested for? When were you tested for? And what were your results, right? So in this case, the person can say, I was tested 2 months ago for chlamydia, gonorrhea, syphilis, and my results were all negative. And, now their status as of 2 months ago. So starting off the conversation with those questions will allow for all parties to share their opinions and also their sexual history. And will also just make sure that everyone is on the same page. So now that we know the right ways to have conversations about sex, I also want to talk about ways not to bring up practicing safe sex. So first thing, when you're talking about your sexual history or another partner's sexual history, please, we want to urge you not to use the word clean to describe a sexual health status, because it implies that someone who has a negative test result is clean, while someone who tested positive for something, like for an STI, is dirty, which is wrong and just, continues to perpetuate a culture that contributes to the shame and stigma towards people who have contracted an STI. So instead of saying, oh, I got tested for this and I'm clean, or I got tested for that and I'm dirty or not clean, you could say, I've recently been tested for, blank, blank, blank infections, and my results were negative. Have you been tested for any STIs? And if so, when, for which infections, and what were your results? That's a very respectful way of talking about someone's sexual history, especially because it can be a touchy and uncomfortable subject. So just keep that in mind. So now that we've talked about the conversations, I also want to go over ways and reasons to disclose your sexual status if you are positive. And, I understand how apprehensive a person may feel about disclosing a positive status, but it's always in the best interest of all parties to disclose a positive and negative status. So there are two important reasons why disclosing a positive status is important before engaging in sexual activities with someone. So one, there are some legal reasons, because there could be some legal ramifications for not disclosing prior to engaging in sexual activities. And second, for you and your partner's physical health, people who have one STI are more likely to contract another infection. So if you're looking to protect yourself and the people you're partaking in your sexual activities with, it's in their best interest to disclose a positive status. And yeah, Brendan said, yes, like, where did dirty or clean even come from? Doesn't make sense. It's terrible. Yeah, I don't understand where they came from either, because it really just, it's just It's really sad. Yeah, I don't like it. I don't really know where it comes from. And like, it just perpetuates a culture of shame and stigma. And, for some STIs, they're treatable. So there's nothing really dirty about it. You can get treated. But yeah, we should just try our best as a collective to, if you hear someone say, oh, I'm clean, maybe tell them maybe that's not the way you should describe your sexual status. Sexual health status. And remember, having these important conversations are the first step to having a healthy sexual experience. And as always, we always recommend using condoms, and remember to get tested every 3 months if you're sexually active. And Whitman-Walker offers free confidential HIV STI testing at our 1525 14th Street Center. And we also offer it on Wednesdays at our Max Robinson Center in Anacostia. And you can make an appointment by calling the number 202-797-4439. And currently we don't do any walk-in appointments, so you do have to call us to make an appointment prior to arriving because of COVID. But hopefully, that could change. And there are other resources in the DMV if you're looking for places to get tested, such as Unity Health, and Medics USA, and you can call Unity at 202-469-4699, and you can call Medics USA at 202-483-4400. And along with getting a test in person at Whitman-Walker, there's also the opportunity for you to do a self-test. And these tests can be purchased at CVS online or in person, or at Everlywell online. And these tests range from $80 to $200, and you can get both STI test kits or HIV test kits or both. But one thing to note with these test kits is they have a user error chance because, you're doing them by yourself. So if you ever feel like your result isn't completely accurate, you can definitely reach out to us. And does anyone have any questions about, having conversations about sex? I'll just wait a few minutes. All right, well, before we go, I just want to give a few reminders about the COVID-19 pandemic and the vaccines. So if you've already been vaccinated, congrats. You've taken a really important step to preventing yourself, your loved ones, and the people around you from illness. And we all have heard about the Delta variant, and it's soaring across the United States. And it's completely understandable why you might want to keep wearing your mask. And, the vaccine isn't 100% effective because, there's more contagious variants spreading. But we just want to urge everyone to continue staying alert. And if you haven't been vaccinated and you are looking for an appointment, Whitman-Walker does offer the COVID-19 vaccine. And if you would like to call us at 202-207-2480, you can receive the vaccine from us. And if you live in DC and you're looking for places to find the vaccine, you can call 1-855-363-0333. If you're in Maryland, you can call 855-634-6829. If you're in Virginia, you can call 877-829-4682. And if you haven't been vaccinated yet and you are not looking for an appointment, we urge you to please continue to follow the CDC guidelines for mask wearing, quarantining, social distancing, and everything else. It's really important that you get the vaccine and discuss COVID precautionary measures with those around you, and continue to wear your mask and keep your distance, especially when you don't know if the people around you are vaccinated or not. If you'd like to support Whitman-Walker, please register for our walk, or you can just, walk or run to this year's virtual 5K, which will be occurring October 23rd on Saturday. And this is a really special year for us because it's our 35th anniversary of the walk. So you can register yourself or your team at walktoendhiv.org. And finally, please follow our social media. You can find us on Instagram, Facebook, Twitter at Whitman-Walker, or you can check our website at www.whitman-walker.org for the most up-to-date information on our services and for more COVID-19 resources. And if you would like to call us, our phone number is 202-797-4439. We really appreciate you guys for coming in today and for tuning in, and we'll catch you at our next Instagram Live. Bye.